With reports of the first human death from bird flu here in the U.S., some folks might be feeling a little uneasy and wondering if this could lead to another pandemic. We spoke to an expert at the University of Washington School of Medicine about what you need to know. Dr. Alex Greninger joins us now in ARC Seattle. He's a professor in laboratory medicine and pathology at UW Medicine. Doctor, thanks so much for being here. Let's talk about this bird flu that's making news. It's a virus called H5N1. Tell us more about it and if it's something that we should actually be concerned about.
Sure. So H5N1 has been around for almost 25 years now, started in Southeast Asia. Various H5N1s have been spreading around. This particular strain entered into the U.S. just a couple of years ago, found its way into avian species or throughout North America, and as well as into our dairy cows. And it's had about almost 70 cases now. I think there was just one that hasn't technically been confirmed by the CDC in San Francisco in the last couple of days. I think that's like maybe 67. We did also have the first death, unfortunately, about a week ago in Louisiana, thought to be in contact with the backyard flock. So it's a developing situation. It's very challenging to know exactly how to message risk on this, to be honest. The last influenza pandemic that happened in 2009, everyone expected it to be H5N1 at that time. People have been talking about H5N1 as being the next big thing, like I said, for over 25 years. And it really hasn't been the next big thing. And so there's a lot of work that's going in to understand that. It's certainly problematic that it's in our milk. It's affected egg prices. There's a lot we can talk about. But I just want to be clear that it's challenging to know how to message the risk. I think certainly like pasteurizing milk's a good thing. Cooking your chicken's a good thing. Sort of avoiding contact with birds because there's so many birds that are infected. We're talking about hundreds of millions of birds that have been infected by this just in North America. So anyway, lots of things to talk about.
So who's most at risk for bird flu? What are the symptoms and how can someone get tested if they think they have it?
Right. So there have been two sort of major ways that bird flu has caused symptoms. The first is in our people who have contact with dairy cattle. That's mostly been through infected udders and milk that gets squirted into people's eyes, and that causes conjunctivitis. And that's been relatively mild. And sort of self-limited. There's been a little bit sort of like I don't want to say like respiratory symptoms, but sort of like just sort of the malaise associated with an influenza, but otherwise quite mild. There have been a couple of cases directly from birds that have infected individuals, or even cases where we don't know how someone got infected. Those that they get into the respiratory tract, the lower respiratory tract, if someone's a little bit immunocompromised, that can be a much more severe case, as the case in Louisiana showed. There's also a case in British Columbia as well that went to the intensive care unit, and that individual was able to fight off the infection. So most of the time it's probably just going to look like an influenza. And the good news is that diagnostics that detect influenza can detect H5N1. They just can't tell you that it's H5N1. They're going to say that it's flu A. So just getting sort of normal testing should be able to detect this virus. And we think that it'll be mostly like other influenzas, with the exception of if you are getting dairy milk squirt into your eye. That's a different sort of tropism of infection.
So in terms of those recent cases, when humans have become infected with the bird flu, it's typically been through contact with infected animals. But some are questioning, how do we know that it's not spreading from person to person? Expand on that for us.
Yeah. So there has not been any documented cases of human-to-human spread for this strain of H5N1 in North America. Previous H5N1s have shown very limited household transmission. So no one's going to say it's not possible. I think the things that are challenging right now, I just told you that all diagnostic tests for flu A can detect H5N1, but they'll just call it flu A. And I'm talking to you on, January 14th. It's high time of influenza for flu A. This is like the peak weeks of flu A. So we have tons of flu A around in people. And so, some of those positive flu A samples are actually routed and typed for H1, H3, and H5 testing in state public health labs. So that gives us a little bit of data in the background. Also, there are diagnostic tests, just a few, not a ton, but a few that will type for H1 and H3. They're not set up to type for H5, but if it's not H1 and it's not H3, it might be something like H5. So those will be like preferentially routed to the state to figure out if there's a undetermined type of what it is. And those are sort of the major ways that we have a way for testing this. Certainly close contacts of people who have had contacts with infected cattle or infected avian species. Those are getting tested more aggressively. We also have over-the-counter flu antigen tests that are available now that one would expect to be able to pick up the H5N1 strain as well. So there's more options for detecting. It doesn't seem, and I would say anecdotally from our own dashboards we have here in the Pacific Northwest, and a lot of interest in this, we just haven't seen anything that really shows like undetected human-to-human transmission. Nothing like February 2020, as we all remember from COVID.
Dr. Greninger with UW Medicine, thanks so much. We appreciate the conversation.
Thanks for having me.